Summer is finally here, and that means bathing suits, barbecues, and bugs. Coming up on Health Minute, presented by Hallmark Health, we're going to talk a little bit about Mother Nature's buzzing culprits, including bees, ticks, and mosquitoes, and what to do if you're bitten or stung by them. That's straight ahead on Health Minute. I'm here with Sara Breglio, a physician assistant at Hallmark Health Urgent Care, and it's that time of year again, bugs.
Bugs.
You go outside, you feel like you're just being attacked by mosquitoes or ticks or what have you. What are some things in general that we can do to protect ourselves from those critters outside?
Bug sprays. They work. The other thing is anytime you're going to be out where you know that there's going to be bugs there, long sleeve, long pants, but again, very difficult when it's 80, 90 degrees out.
So if we're going to use a bug spray, what should we be looking for?
So you want a bug spray with a compound called DEET, D-E-E-T.
Okay, and that's safe to put on your kids?
That is safe to put on your kids,
okay.
Yes.
Okay. Mosquitoes are outside all the time. Is there any truth to people being more prone to being stung by mosquitoes?
I think that's an old wives' tale. Typically, we don't have sweeter blood or sweeter skin. I think one thing that can definitely attract them a little more is if you're wearing really sweet perfumes, but people themselves are not more prone to insect bites than others.
Okay, I think there's a lot of concern this time of year as well for ticks. If I find a tick on me, what are some things that I need to know about that?
So most tick bites are benign, but of course there are ticks that do carry some of the infections that we all know about, most commonly being Lyme disease. So in general, you want to look for a few things. Duration of attachment, duration of biting is very important. So the risk of contracting some of these illnesses, specifically Lyme disease, would be attachment of the tick to your skin for over 24 to 48 hours. The other thing you want to look for is the very classic rash, the bullseye rash, the erythema migrans, and also if you're having any body aches, chills, sweats, fevers, anything like that, you'd want to be seen.
And moving on to bees. They're buzzing, they're out with the flowers. If I get stung by a bee, what do I have to do?
Do you have an allergy to it? Do you know you do? If people know that they have an allergy to bees, make sure you talk to your doctor about carrying an EpiPen, because we've all seen the anaphylactic reaction that people can have to bee stings. So the swelling of the throat, swelling around the lips, the eyes, difficulty breathing, wheezing, people can vomit, they can even lose consciousness. So if you know you have an allergy to bees, make sure that you carry your EpiPen, and if you're bit, you use it immediately. With that said, most reactions to bees are pretty localized. You'll have that sting initially, and then maybe a little pain and itching, and a very localized response to wherever you were bit.
Sara, thank you so much for joining us today. This was great information and so helpful for us this summer.
Thank you, it was my pleasure.
Thank you.